I'm Jerrin Snook. I'm a doctor of physical therapy with Rock Run Physical Therapy, and today I wanted to talk to you about one of the many causes of vertigo. Now, vertigo is the sensation that someone or the room around them is spinning. Different than being dizzy, which we can classify as many different things, but vertigo is specifically the sensation of spinning. So what I wanted to talk to you about is called benign paroxysmal positional vertigo, or just abbreviated as BPPV. Now this is a very common diagnosis, especially after someone has had severe head trauma, like a concussion. It's very common in the older generation, just because our bodies just generally, they wear out, wear and tear on the body, and so this can happen. Now what this is, not a very good artist, but this is an ear, and inside of our ear it's about the size of a dime. It's this little apparatus, and here's a bigger blown up picture, and these are these canals. Now these canals are filled with fluid, and their purpose is to give us a sense of how fast, what direction, if we're spinning. They give us that kind of sensation. If you've ever been on a roller coaster and you felt like you were still on it after getting off, that's because your inner ear, some of that fluid can still be moving inside of the inner ear. Now this is different from hearing. Hearing is a separate part of the inner ear. They're very close together, but completely separate. Now, what can cause this BPPV is we have usually we refer to them as crystals, but what can happen, they can get stuck inside these canals, and as we go to move, especially like getting in and out of bed or bending over and standing back up, what can happen is as we do that, those crystals will move around inside these canals. They typically fall into one of the canals in particular, but it can happen with any of those movements. Bending over, looking back, drinking a soda if you just tilt your head far away back, and it can cause vertigo. So this is very common with head trauma as we get older, but they get stuck here. And as they get stuck here and we move these different directions, they move around, and that causes the fluid to shift. And it sends a signal to our brain telling us that we're spinning, which in reality we are not. And so BPPV is very treatable. We can treat it in physical therapy very easily. It's had a success rate between 1 and 3 treatments. Most people can be cured from about 1 to 3 treatments with some very simple treatments. So that is benign paroxysmal positional vertigo.